We'll start off with a trial that is, I think it's going to be a 26 depth. So that means from here to here is 26, and from here to here, the interdiscal height will be 10. I think it's going to end up being a 12, but we'll put a 10 in just first to make sure. Now that's pretty good, and it's stuck in there, and I think that a 12 would be too big for her. So I think it's going to be a 10 by 26. We'll go ahead and pull that out. You don't want it too loose, but you don't want it too tight. So now we'll go ahead and irrigate. What we've done in this case is the actual little plastic tube that the Midas Rex bit comes in makes a perfect portal from which you can insert your bone graft, and it fits perfectly with the annular hole. And then if you use the bone tamp that comes with the DR 366 set, then you can insert the tube into the disc and then push it through like you're putting a ramrod down the barrel of a gun. All right, we've sized the implant. We're going to use a peak capstone implant filled with the patient's locally harvested bone from the facetectomy and the laminectomy. We feel confident and comfortable using this bone. And we'll go ahead and tap this in. All right. You think you're in as deep as you can go. Remove the inserter. Take a look. There's the posterior aspect. It is deep to it by at least 3 or 4 millimeters. But I'd like it to be a little deeper, and then I'd like to make it, instead of oblique or tangential, I'd like to make it more horizontal. So I use the fork pusher. So we'll put it over here on that most medial part, angle towards the lateral, and then tap it. Once you've accomplished that goal, the most important aspect of the whole case at this point is take a nerve hook and test and feel and probe the cephalad, caudad, anterior, posterior aspects of all neural tissues. Make sure there's no cartilaginous, bony, ligamentous, discal debris that could be hidden in a sulcus somewhere